How do beta-3 agonists work for bladder issues? Imagine a tiny switch inside your bladder that helps control when you feel the need to go. Beta-3 agonists are medications that target this switch to help manage overactive bladder symptoms. Overactive bladder causes frequent urges to urinate, sudden leaks, and a feeling of urgency that can disrupt daily life. These symptoms happen when the bladder muscle, called the detrusor, contracts too often or too strongly, even when the bladder isn't full. Beta-3 agonists, like Mirabegron and Vibegron, work by activating specific receptors in the bladder known as beta-3 adrenergic receptors. These receptors are found mainly in the smooth muscle of the bladder wall. When these receptors are stimulated, they trigger a chain reaction inside the muscle cells. This process involves activating an enzyme called adenylyl cyclase, which increases the levels of a molecule called cyclic adenosine monophosphate, or CAMP. Elevated CAMP causes the bladder muscle to relax, making it easier for the bladder to store urine without feeling the urge to go constantly. This relaxation effect is mainly during the storage phase of bladder function. When the bladder is filling, beta-3 agonists help keep the muscle relaxed, allowing the bladder to hold more urine comfortably. This reduces the frequency of urges and the chance of accidental leaks. Interestingly, these medications do not interfere with the emptying phase when the bladder contracts to releases urine. This targeted approach helps minimize side effects often seen with older medications that affect multiple pathways. Research suggests that beta-3 agonists might also influence nerves in the bladder lining, reducing abnormal signals that cause the sensation of urgency. Some studies indicate they may inhibit nerve activity associated with overactive bladder, further helping to control symptoms. Because they mainly work on the storage phase, they tend to have fewer side effects like dry mouth or constipation compared to older drugs called antimuscarinics. It's important to note that beta-3 agonists are approved for treating overactive bladder, not for bladder cancer or its prevention. They are designed to improve quality of life by reducing bothersome urinary symptoms. They do not treat or prevent bladder cancer and should not be used as a substitute for cancer therapies. However, for patients with bladder issues related to overactivity, especially those who cannot tolerate other medications, beta-3 agonists can be a helpful option. In clinical practice, doctors often recommend beta-3 agonists when lifestyle changes and first-line treatments do not provide enough relief. They can be used alone or with other medications, offering flexibility in managing symptoms. As with any medication, it's essential to consult a healthcare professional to determine if they are suitable for your specific health needs. In summary, beta-3 agonists work by activating specific receptors in the bladder, causing the muscle to relax during the filling phase. This helps increase the bladder's capacity and reduces urgent feelings. They are a significant step forward in managing overactive bladder symptoms with a generally good safety profile. While they are not used for bladder cancer treatment, they play an important role in supporting bladder health and improving daily comfort. Always talk to your healthcare provider to find the best approach for your individual situation.